Really, the journey began as a young attending when I had the privilege of reviewing for the journal. And from that point on, I was mentored by Dr. Rosenfeld, who was the editor at the time, and worked my way up through the star reviewer, became an editorial board member and ultimately an associate editor, and then under the leadership of Dr. Kraus had the privilege of serving as deputy editor, brought the exciting platform of patient safety quality improvement to the journal, as well as our residency reviewer development program, and ultimately it led to me being editor today. And it's been just a fantastic journey, but hopefully, as you can tell, it's one that's not done in isolation and requires a team, and for that I'm very grateful to the mentors and also the staff here at the Academy that I have the privilege of working with. As a journal, both Otolaryngology, Head and Neck Surgery, and OTO Open, we have a huge fiduciary role to our otolaryngology patients and all of our providers as well, to make sure that we're always rendering the best level of care that is contemporary and evidence-based. And for me, that's the exciting thing that we can do with this journal. It's certainly a springboard and platform for current science and future science as well. Again, just always going back to the patient. Yeah, certainly I think everyone can feel time constraint being one of the biggest challenges. We're so fortunate to have wonderful voluntary reviewers and associate editors to do a quality review. Certainly takes a fair amount of expertise and time, and as one can imagine, we're pulled in different directions. We have other jobs, responsibilities, both inside and outside of the home. And so I think that's one of the greatest challenges that across the country we're facing with respect to publishing and peer review. You know, ways to overcome that is to ensure that we have a well-oiled system, that we have excellent training, and it goes back to that we really start to try and mentor and educate residents in becoming peer reviewers so that they go through that learning curve early on in their training and can hit the ground running. It also requires just having a strong support system with respect to editorial staff, and we're really fortunate that that's one of our strengths. We are so fortunate to have talented researchers, and at the end of the day, they have a lot of choices as to where they can submit their research, and hopefully they'll look at otolaryngology, head and neck surgery, and OTO Open. One of the things we've really strived to do is make sure that the submission process is seamless. We don't want that to be the time-consuming part of their research. So there are many tools that are available on the website that is put forth through our publisher, Wiley. In addition, it becomes really important that the peer review process enhance the publication, and so we like to start out early, and I'm excited that we have a residency reviewer program under the direction of Dr. Shin, where residents who are in the middle of their training have an opportunity to have one-on-one mentorship. We know that these residents are going to go on, they're more likely to become star reviewers, they're the future of our journal, and so hopefully authors will want to submit knowing that they're going to get quality peer reviews from experts in the field. And it really segues back to the end of your question. You know, at the end of the day, peer review is supposed to be collaborative and constructive in feedback. As far as the future, one of the other things that we have to offer that I'm very excited to share is that we now have a handle for social media and Twitter. It's at OTO Journals, and this is a great opportunity for information distribution, if you will, where researchers, when they get published or even present at our Academy meeting, they can share with others, not only across the country, but around the globe. And hopefully in doing so, it one, gets the important information out for patient care, but two, can develop relationships and future research collaborations. So obviously you have to be passionate about peer review and experienced in that field. Probably one of the best pieces of advice that I received was from Dr. Jack Kraus, our former editor, and he really encouraged me to expand my platform and knowledge within the Academy. And so prior to this editor role, I had the privilege of serving as our coordinator for research and quality. And it really opened up a lot of windows and doors, if you will, for me to understand how much talent there is in our Academy. Working directly with, for example, the Guidelines Task Force, working with Region and understanding the potential there. And so certainly that important piece of diversifying your portfolio and building relationships, getting to know folks outside of your field. And for us, we need to remember that 80% of the Academy or so are actually in private practice. And the responsibility of the editor and the mission of the journal is to serve all of our membership. And so having that expanded network, keeping an open door and window and an open mind and diversifying your experience would be my advice for anyone who aspires to enter into this position. So yeah, that's a great question. I feel like you always need, as an editor, to be one step ahead of the game. And so earlier I touched upon the importance of social media as a means of information distribution. And we all accept that the future is coming when we will be paperless, and so making sure that there's a very strong electronic platform. I think another both exciting yet also somewhat intimidating and maybe concerning aspect of the future surrounds AI, or artificial intelligence. So we can think about this from a research standpoint, where it's a wonderful opportunity to use machine learning in a positive way. For example, to look at how can we take data from a CT scan and determine, is this cancer or not? How can we take a health profile and determine who's going to be at risk and requires additional studies or future health screenings? At the same time, the flip side is AI makes it really easy potentially to encounter ethical concerns surrounding plagiarism, etc. And so I am certain that there will be future position statements, etc., surrounding the use of AI in publication. I think the journal is cutting edge. Certainly we saw this during COVID. It was the fastest means of getting out important, impactful information during an unprecedented time. And in fact, you know, my hat really goes off to Dr. Kraus. He watched the impact factor escalate to almost 6. And so if you think about our role as physicians and healthcare providers needing to be evidence-based and contemporary, it is a great resource. It provides guidelines, expert consensus statements, position statements that are up to date and again, evidence-based. It also meets all of the needs of the subspecialties, so there's a very robust, and this is important to me, platform surrounding comprehensive otolaryngology, your bread and butter cases, information that is seen in the clinic, in the operating room, yet there's also the opportunity to delve into the different subspecialties and then to expand into important topics such as patient safety, quality improvement, the business of medicine, etc. I think it comes back to that the goal of the journal is to publish contemporary articles and research that are related to the care of otolaryngology patients. Clearly the impact factor speaks to the fact that we are current and being cited, and so it's a wonderful opportunity for researchers to get their information out there, to get known and recognized, and that will help with future collaborations and development. I know I can speak from personal experience. Once you start publishing in a certain area, you then start getting interviewed to give talks, you may meet other collaborators and like-minded people, and that just strengthens your research opportunities. So I'd like to think of it as a springboard for that trajectory with respect to research development. So I think a little depends on where I was in my career when I received the advice. So hopefully there are a host of different otolaryngologists out there listening to this. When I was early in my career, I was given the advice of saying yes to everything. You don't know where the next opportunity lies, your next mentor, and that really served me well. However, once you get to mid-career, it's hard to do everything and do it well, and you do need to start to say no, but say no to the things that maybe don't resonate with you, that aren't exactly your passion. Say no to the things that may not help you get to the next level or where you ultimately want to be. But in saying no, it can actually be a positive, meaning it's an opportunity for you to give someone else an opportunity, for you to now serve as that mentor or that sponsor. And then as I reflect where I am now as a senior leader, I would have to say the best piece of advice I was given is that leadership is a marathon, it is not a sprint. I love to run, and so that mantra really has served me well.